Hello and welcome. Today we have a special guest from India, Dr. Niharika, who has been practicing here orthopedic and surgery training. Let's learn about her profession and career in Germany. Hi Niharika, can you please introduce yourself and share the orthopedic surgery background?
Um, I'm a doctor by profession, and I'm currently doing my residency in orthopedics and trauma surgery, which would be parallel to masters. So I'm pursuing that currently.
So when it will finish?
The residency in Germany for any surgical branch is 6 years. So I have been doing it since last 5 years, and I need another year. It will be more. It can be bit plus minus to that, as there was COVID in between, and that can change the path a bit. But otherwise, it should get over in another year.
What inspired you to do this orthopedic surgery course and what brought you to Germany?
I would say pursuing orthopedics was my childhood dream. I think since the time I didn't even understand what it means. Somewhere I had the thing that I wanted to treat bones when I was maybe 5 or 6. When I learned medicine, the interest remained same. I would like to thank my seniors for that in college, who saw to it that my interest remains, because it is very rare in India to have a female orthopedic surgeon. So they didn't discourage me. They saw to it that my interest stays, and it remained. And one of the surgeons who treated me when I was injured, he suggested me that Germany or Switzerland is a good destination to get trained in orthopedics, and that's how it began.
What were some of the challenges you faced professionally and personally when you moved from India to Germany?
Um, Professionally, I would say the main thing which we need to learn is the language. To come from when we come from a country where we speak so many different languages, like we also know the importance of it there. Like until and unless I don't understand what the patient is saying, I cannot treat it. So language is the main thing you need to learn before coming here. Personally, I would say it's a huge cultural difference, and I think it affects professionally too. It is not just personally, it affects professionally too. We come from a complete different culture, and here the culture is totally different. That's the main thing. Weather is different, yes, but I think we get acclimatized to it. Initially, it was also, I used to stay in a smaller town where there were much I didn't have much contacts. I had a smaller social life, smaller social circle. So that was during the initial days, but now, as I would say, it is pretty much good, and I think we keep on integrating day by day more.
What are the most common orthopedic conditions you treat here in Germany during your practice?
The most common cases, it depends also sometime on the season what comes. What we have throughout is when older people fall. It goes for the most common injury in elderly is hip injury. So that is one of the most common cases. Also, when elderly people fall on the hand, the here it breaks in the near the hand. So those are the common ones. There are also shoulder injuries, which are also common in the elderly. During summertime, there are a lot of people who ride bicycles, who go on e-scooters. With bicycles, the common injuries are on the ribs, shoulder area. With e-scooter, there's like everything can get hurt. It is, I would say, it's a bit dangerous thing. So it depends on the weather. In winter, it is when there is glat ice around and people tend to skid. There is a whole another set of injury which happens. And with motorcycles, it's the legs that usually break. So that are the common ones.
Can you please share a memorable case which impacted you career wise and also personally? Any specific case which you have in?
Hmm. I think when I was an intern in India, when we were in orthopedic rotation, there was a patient who had like pretty severe injury to his leg. And after getting operated, he could get up and walk eventually. It is not like on immediately after the operation that you can stand and walk, but when I saw him standing up and walking, and that's the time I thought, as I said, it was my childhood dream to get into this. But there were such incidences, maybe multiple times, which kept on telling me, yes, I want to do this. I want to see someone, if I treat a person the right way and with right treatment, the person can stand and walk sometime sooner or later, depending on how bad it is. But it works out in that way. So that was one of the thing which I would say was professionally, which helped me going more closer to this, and which I think I would remember, because if I say one particular thing, I would say that's the thing.
Okay. How does the healthcare system in Germany is different in comparison to India, like process or maybe treating patients?
The healthcare system is different, yes. What we have in India is, I think, within there are different aspects in which I would say how it differs. There is a way more load of documentation which we need to do here, in additionally to what we do in India. So that's one of the differences. Then the health system, how it is made here, like in Germany, it is, if you come here, as soon as we come here, it is for the visa purpose itself, we need an insurance. So insurance is compulsory, and through that, like everything goes through the insurance. So that is another difference what we face in India. It is different. There is a set of population that is insured and set of population which is not insured. There are the government hospital, the private hospitals like set up, so you can choose from where we want to go. Here it is not classified exactly like that. There are hospitals, and depending on your insurance, there is, like, if you can go directly to a specialist or you cannot go directly to specialist, depends on your insurance status. So yeah, the system is designed differently. Yeah. And I think, like, but that comes more rather than the system, I would say that plays a bigger role into the treatment part of it. As I said, culture here and the difference of culture plays also a role, but that is more into the treatment part of it probably, rather than the health system by itself.
Okay. From the treatment point of view, what big difference you observed in Germany compared to India?
I would say in terms of treatment, where I mentioned previously that culture plays a role. Uh, for example, if there is an elderly patient, which we have, as I said, the common injury is in the hand. When they tend to fall on the upper limb, the injury is in the hand. In India, there are a lot more fractures which are treated conservatively, that is without operation. So when it could leave a small, like, it could leave a small, I don't know, it's difficult to get the English word now. Like the mobility, in the Einschränkung, as they call it in Germany, in German. Sorry, Einschränkung. Yeah. So the
Contraction.
yeah, the mobility is restricted a bit. It could happen in some cases after the fracture heals conservatively, but we have that there is a window, like if a patient is maybe 80 years old, and if the person is, if the slight reduction in mobility, if it is not going to cause any difference to the day-to-day life, it's what something we can leave it at that stage. And so there are a lot of fractures which are done conservatively, and here I would say that there is a tendency, even the patients want that, no, we want to, the like the mobility should be full, or we want a faster healing thing, and so it is operated more overall. Then in terms of treatment, I think what we also, like, as an orthopedician, apart from treating the trauma part of it, we also do like knee replacement, hip replacements. I read a very interesting article about this, that what are the aims, what you want after the operation is done. Like, we have patients here who are 70-year-old or even maybe more, who do cycling, skiing, and they want to do it after that. So they want a knee replacement to further to continue with cycling or with exactly, with skiing and their activities. Whereas like the study said that, and I think I found it really interesting. Whereas in India, if a patient is to come with similar age to us with the question of knee replacement, hip replacement, it is to be more for, yeah, that I want to play with my grandkid, and that's why I want my joints to move better. So it is it's always said in ortho or trauma that we treat the patient and not the x-ray. So that's another difference. So I think the lifestyle, the culture, that affects to what is the aim of the treatment, and that changes the path from how we think and how it should go.
What are some of the challenges and advantages working in Germany as an orthopedic?
um, I think as a challenge, I would say yes, language is a challenge. It was a bigger challenge in the beginning. Slowly over time it has gone better. uh, yes, but that I think that will remain, like we keep on learning every day new things. So that is one thing. And I think in ease point, I would say, like, I'm doing residency here. It's a longer residency. It's a 6 year thing. In India it's a 3 year thing. There is still like tremendous load of work which we have to do, but like other, like I would still say there is a bit more of life work balance here compared to India during residency, because eventually it happens, like when you finish with your training and when you work independently as a surgeon, then you can decide like what I want to do, what I don't want to do, how long I want to work. But during the initial phase, I think having uh, what they have it here, like the whole system is more focused on work life balance. Yes. So I think I would say it is better compared to India. uh, I have seen like my friends from other professions. Yes, I work longer than them, but I would still say that there is a work life balance.
So, Niharika, what advice would you give to aspiring orthopedic surgeon who is willing to work internationally like you?
If someone is particularly looking for Germany, I would say that starting learning a language earlier is good. B2 level is the minimum requirement what they have here. So as sooner you start, the better it is. And if they're sure that they want to pursue their further studies, or they want to stay eventually in Germany, or maybe that for that matter any other country, I would suggest to take the step sooner. Like instead of I know like colleagues who have done masters in India and then they shifted here, and I came here at an earlier stage. So I think integrating or understanding the system here, how it works, then even getting comfortable with the language, the how the hospital works, how the setups are, the sooner you come, I think the better it is. Because you during the years where you are like you're modeled into this, if you're modeled out in a different way, it is a bit more difficult to reset it and relearn. So the sooner you start, if you're sure if you want to come, the better it is.
So, compared to the ह्याच्यामध्ये नाही आहे question. Compared to the scope of studies, like doing masters in India for orthopedic, it's like 3 years, and here in Germany it's 6 years. It was so it's little bit longer than India, almost double the period. Does that change the scope of study?
I think it is longer because there are some regulations and rules from the work ethics committee here. So how long someone is allowed to work, like we work more than 40 hours a week, yes, but still there is a cap to the number of long shifts which we can do. And I think that's the reason maybe it was eventually extended to 6 years. And yeah, but with the in terms of training, it is difficult for me to say. I haven't trained into orthopedics and trauma in India. I did my graduation there, I did my internship there. So directly a comparison is difficult for me to say, but I think this could be one of the reasons what I think why it is longer here, because what we are officially not allowed to do, maybe that's the reason, because we need to finish a certain number of cases in every area. We need to have seen certain number of patients to give the exit exam, and to achieve that particular point, I think it takes longer here because we're not allowed to work beyond particular hours.
So you mentioned number of cases you need to do it. Is there any certain number defined, or it's just approximately like I have to do, let's say, X number of cases?
No, there is a number which is defined. Like when I give my exit exam, there is a logbook which you need to finish, where it is said, like in each and every criteria it is defined how many surgeries of hand I need to do, how many surgeries of elbow I need to do, how many surgeries of um, knee, like each and every, not bone but part of the body is written, how many number of surgeries in this particular area need to be done under guidance, and only after that we are allowed to give the exit exam.
So how important it is to stay up to date with advancements in the orthopedic surgery, and with this hectic schedule, how do you keep yourself up to date?
uh, it is definitely important to keep learning new things, and it is also compulsory, rather I would say. We have regular fortbildung, as they call it here. There is a similar thing in India too, that we need to attend a certain number of conferences which give the new updates into this. There are conferences arranged here for that. Then also nowadays I think LinkedIn is something where I also find, like, there are certain pages on that where surgeons from all around world post their cases there, and they discuss things openly. If they will post their x-rays before the operation, after the operation, they will first, and they'll write a detailed history about the patient, and in that it is very openly discussed. Then someone suggests that this is a new thing which has come and this is how you can use it, or so that is another place where we get to learn the new things. And the hospitals also play a major role, like if there is anything new coming up in the market, they will, like, some one from the team maybe they might go to this workshop they are putting up, or there are studies being done in various hospitals where such things are published, and we try to keep a track of it, and if we think that this is something which we can use, which is useful for us, and then it will be like it will be brought into the daily work there. Even after completing after completing masters, we need to even as a surgeon, there are a number of fort buildings which you need to do, or which you need to attend every year to keep your knowledge updated. Otherwise, because we have the medical license which we have, we can only renew it. It's also there in India and here too. We can only renew it after like a certain period of time if we attend the said number of fort buildings. That is like, or it's called like continuous. I forgot the word about it called in India, but it is for building. So you need to keep updating. It is compulsory from the medical council side too.
So Niharika, how do you balance your professional life with personal life with this hectic schedule in a different country? In Germany, everyone has to do his course by himself or herself. So how do you manage it?
Mm, I think I learned this over time. As the time passed, I think I mastered it slowly, or maybe still not mastered, still mastering it eventually. Yes, I was not used to doing household chores in India. I always like cooking. I still like it, but other things were taken care of in India. But you need, as you said, you need to do every small thing here by yourself. I try to manage it this way. I have like two weekends are working weekends for me. Like not the whole weekend, but it's either Friday, a Saturday, or a Sunday, which is working for me. So on that particular weekend it is difficult to manage that. But the non-working weekends, I see to it that the cleaning up of the house, things or grocery shopping is done during that time. If it's a working weekend, then I try to manage it somewhere on a Monday or a Tuesday, depending on where it is placed. I have 24-hour shifts.
Okay.
So after the shift, if there is no other time possible to go to the supermarket and buy groceries or finish up other things, then I try to, like, before I come home and maybe take a rest for some time, I go from the hospital directly to the market. I buy my things and I come home. So that's how that part of the daily course is taken care of. um, in other terms, I would say with social life, I think my friends are very um, accommodating, is that I would say. Like, we try to manage the time together, and so that we can meet up and have spend some time together. Then I have some friends who are also into medicine who work in Bayan. For us, if we want to plan a trip or if we just want to meet over a weekend at her place or at my place, then we like, I get my month schedule where I'm having 24-hour shifts, or the when how is the free time. I get the schedule in 2 months in advance. So, and I can, when we do the schedule, it's we do it this way that I can wish for a particular weekend. I want this weekend off. I don't want this weekend off. I don't want to work on this particular day. So we plan it together in advance that we'll take this weekend off together, and then it works out. So it has come over time, but I think it's going well over the time. And yeah, what I did like 2 or 2.5 years back is I reduced my travel time. So I stay now
That's a big-
directly next to the hospital,
Yeah.
and I think that has brought a big relief in my daily schedule.
Just like this weekend you reserved for this podcast thing. I think we talked 2 months before, if I'm not wrong.
I think it was even further back. I don't know. I thought maybe end of last year somewhere, maybe 6-7 months back.
Yeah.
I'm not sure.
So Niharika, what are your aspirations and future goals in orthopedic surgeon, your career?
um, I would be finishing my residency in another year. And after that, I would like to think in which particular side if I would like to specialize. Mm, and overall, I'm not sure if it's an open thing. I will take a decision later in my life, also depending on how personal life goes, if I would like to stay back here or go back to India. That's another thing which is there on my mind, but I'm not very sure about it right now. And I would like to keep that thing open. But there are immense number of opportunities which we can use here also. If eventually I would like to go into research, that option 2 is available here. I can go to some uni clinic and can start, like, I need to apply personally to the professors there. If I find some area interesting and if they accept it, that's another thing which is also a probable thing which one can do.
So Niharika, any final words of wisdom or encouragement to our viewers who is considering career in medicine or in orthopedic?
If they're sure they want to come here, I would say start learning the language. That is the first step towards this. Then they need to have an overall view of what kind of documents you need to apply from there. That is a time taking process, so they need to start with that in advance. But without a language certificate, or without a B2, it's we cannot, like, even directly apply. The basic requirement for even applying for the license here with the medical council, you need a B2, and without a license we cannot start working here. So those are the first steps towards it. And there are 2 levels of exam which are done here. First is the Fachsprachprüfung, that is like the medical German exam, and a communication exam, rather where you're tested more into how your language skills are, how you speak to patient, how you communicate, your body language, rather than the medicine part of it. So that's the first level, or the first exam. Once you clear that, you can give the other exam, which is approbation, because coming from a non-European country, so from when we come from that, we need to give the approbation exam. The Indian medical education is accepted here, but you have to give the license exam. If you come from some other non German speaking country within Europe, you don't need the approbation exam, you just need the language exam here, the medical language exam. And for us, it is also compulsory to give the approbation exam. So they can also get acquainted to what is the type of exam, how it goes, so they can prepare in that particular direction. And I would say it is more, you have to prepare yourself maybe more for the language exam, because medics, the second exam is more about medicine. So you have graduated, you have already learned it, so you know it. The language exam, you need more preparation, and it is not only restricted for the exam, but it is something which helps you in your further professional life here. Because unless and until you have the right set of vocabulary, unless and until you cannot communicate well with the patient, you cannot treat someone in the right way. And I think it is not just the words, it's not just the languages. Because it happens so often that we have patients, especially in Frankfurt, which is so international. It is not very uncommon in Frankfurt that you have patients who don't speak German, and the other language which I can speak is English, Hindi, Marathi, and a patient who don't speak any of this. So still you need to find out where the patient is injured or where the pain is, and you need to find out. So in that case, communication skill is what plays a role. You can do with hand signs, or there is a translation app, but you cannot, sometimes there is no time to use it, because it's something which is very emergency. In an emergency situation, you need to react very soon, and you don't have the time. So communication skills do play a role.
So, thank you, Niharika. It was really nice talking to you, as always. I hope our audience have got very good knowledge of orthopedic surgery in Germany. If someone is willing to pursue here as a career.
Thanks for inviting me to your show. I had a great time. I enjoyed my time, and I would be great. It would make me happy too if this is useful for someone who is inspiring to do this. And I would tell all our viewers, if you like the show, please do like, share, and subscribe to the channel.
Thank you. Thank you so much.